I'm Peter Block at the American Heart Association annual meeting here in Chicago for On the Scene. With me is Dr. Patrick Moriarty. No Sherlock Holmes jokes here. This is serious business. Dr. Moriarty is part of the alurocumab trial, a PCSK9 inhibitor, which clearly seems to have promise. Patrick, tell me about this trial.
This study was called Alternative, and it was designated for patients who were statin intolerant, which in some populations is as high as 25%. My population I see is over 50%. So we tried to see if alurocumab would be efficient in lowering LDL in this patient population in comparison to ezetimibe 10 milligrams, which is the standard dose. But what's interesting about this, we had a 4-week run-in period of placebo to kind of wipe out some of these statin intolerant patients. Plus we had a statin arm, which included atorvastatin 20 milligrams QD.
So how did you get the statin into the statin intolerant patients? How did that work if you had a statin arm, or were those not intolerant patients?
Well, they were designated intolerant because they had to have at least 2 statins or more that they couldn't take based on myalgias, and one of the statins they were used to take was at the lowest dose possible. So they knew they were going to potentially get a statin, but we had a third arm of this to validate the benefit of this drug, and that was an open label with 3 years of open label with the alurocumab once you finish the study, and 90% of patients that did finish the study went into the open label.
Okay, so the short version is this is really a specified subgroup of patients that were statin intolerant and had trouble with statins. Ezetimibe, pretty good drug, turns out, and now a PCSK9 inhibitor. What did you find, Pat?
We find the primary efficacy point was looking at LDL reduction after 24 weeks, and the alurocumab reduced LDL in the intention to treat group by 42%, where the ezetimibe reduced it by about 15%. So
the PCSK9 inhibitors are clearly winning here. We are seeing this as we go forward. As you look at this trial and the outcomes of this trial, it's almost silly for me to say, what do you think is the future of this? But tell me what you think.
Well, I think the PCSK9s have a very positive future as we know now. Their risk of having side effects, as we're showing, is not as dynamic as other lipid-lowering drugs are, and its benefit of lowering LDL is dramatic. In this alternative study, too, we found that over 40% of patients reached their LDL goal in the sense of getting their LDL goal less than 70 or 100, because 50% of these patients had cardiovascular disease and their baseline LDL was over 190, where less than 10% of those patients on ezetimibe reached their goal. So it's the efficacy also that's very important.
Okay, so let me ask one sort of silly question. Can LDL go too low?
Wait to see. I don't know. I do LDL apheresis or lipoprotein apheresis. Actually, I have the largest center of this kind in North America. We treat about 40 some odd patients every 2 weeks to lower their LDL with these machines based on their risk of disease and their elevations. And I get patients down real low, and I have not seen any adverse effects as of yet with these patients. In the outcome studies that are going on now with the PCSK9 inhibitors, they will prove in the future that LDL lowering might be better. As you saw in the outcome of the Improve It trial, that going down to the 50s is not only safe, but effective. So we don't know yet where the end is. Time will tell.
Okay, so I guess PCSK9 inhibitors are probably here to stay. What about the FDA? Where do we stand with that?
Well, where the FDA is reviewing now 2 companies' submission for approval for their drug, and it's possible we might see a somewhat limited approval for the PCSK9s by sometime next year.
Exciting stuff, and obviously a brand new way to take care of patients with hypercholesteremia, particularly high LDLs. Thank you, Patrick.
You're welcome.